Good morning, doctor. Kindly introduce yourself.
Yeah, good morning, everybody. I'm Dr. Sarat. I'm a reproductive medicine specialist practicing at Indigo Womens Center Chennai.
How is infertility treated?
The infertility will be treated according to the cause. So first we have to investigate the couple, and there are multiple tests are available to find out whether it is an annuality infertility or tubal factor infertility or May factor infertility. According to the cause, we'll treat the couples. No? So always we have to individualize the treatments according to the patient's requirements or patient's condition.
What test should a doctor perform?
We'll subject the male partner for semen analysis. If the semen analysis is within normal, we will proceed with the investigation of the female partner. First thing I do is I subject the woman for transvaginal ultrasound. By doing transvaginal ultrasound, we will be able to know the anatomy of the female genital tract, whether the uterus is whether normal or any abnormal swellings are there, whether any congenital anomalies are there, or when the tube, when it comes to the tubes, usually normal tubes can't be visualized by the ultrasound examination, or when they are distended with the fluid like hydrosalpinx or hematosalpinx or ectopic pregnancy, we will be able to visualize the tubes. Then coming to the ovaries, usually by looking at the ovaries, we will be able to see whether there are any abnormalities are in the ovaries, or whether the woman having polycystic ovarian disease or endometriomas. All these things can be realized by subjecting the woman for transvaginal ultrasound examination. In normal menstruating women with regular cycles, 80% of them they do ovulate. So those women who have irregular menstrual cycles or delayed periods, will subject them for further investigation to find out whether the woman is ovulating or not. In a regularly menstruating woman, if the husband's semen analysis is within normal, then we'll check the fallopian tubes, whether the fallopian tubes are normal or whether they are blocked. The commonly used test will be hysterosalpingogram. In this particular test, by transcervical route, the radio opaque dye will be injected into the uterine cavity. Then if the tubes are patent or if they are open, the radio opaque dye will spill into the abdominal cavity and it will be spread in the abdominal cavity. So then we presume that the tubes are patent. If the tubes are blocked, the dye may not be able to enter the fallopian tubes. This particular scenario, she may have to be undergo diagnostic hysterolaparoscopy to find out whether the tubes are functioning normal or not. If the tubes are functioning normal, then we'll reassure them and they will give them time to try for some more time. If the tubes are damaged or irreparably damaged, then we'll suggest them assisted reproductive technologies to bypass the tubal factor.
How is a semen analysis done?
This semen analysis is done in the andrology lab, and the man will advise them to have 2 to 3 days of abstinence because to match the natural frequency of the intercourse. And the semen can be collected either by masturbation or by coitus interruptus. After liquefaction of the semen, then we'll subject it for the analysis. In semen analysis, we'll try to evaluate the sperm count, sperm motility and morphology, and to find out any other abnormalities like increased number of pus cells or any agglutination of the sperms will be looked for.
What medications are used?
Yeah. So there are many medications are available in the armamentarium of the infertility specialist, and in cases of male factor infertility, we do treat them, we do give them a medical management for about 3 months time to see whether the man is responding to the medical management. There are many medicines are available in the market, including the clomiphene citrate, then antioxidants, minerals and micronutrients, and gonadotropins. And coming to the female factor infertility, there are many drugs are available for ovulation induction like clomiphene, letrozole, and gonadotropins.
Are there any risks associated with taking fertility medications? Can they increase a person's risk of cancer?
Yeah, it's a good question. No? So many couples they do ask whether these medicines may have any future impact on the woman's health. No? So many a time these medicines they are quite safe, and usually the effect will go by the end of the treatment cycle. Whether if she becomes pregnant is fine, otherwise there is no impact. Once she gets her period, there is no impact on the woman's health. Whenever there is a cell proliferation, one or two cells may go into abnormal mitosis, or they become abnormal and may lead to cancers. So, but this is that theoretical possibility is there, but in practice we don't observe any risk or any increased risk of cancers in this particular group of women who are on fertility medicines for a longer period of time.
What is artificial insemination?
Yeah. In normal coitus, usually about 150 to 200 millions of sperms will be deposited in the vagina. By the time they reach the uterine cavity, the sperm count will be about 5,000. Then by the time they reach the site of fertilization or the ampullary portion of the fallopian tube, the concentration will be about 200. But in cases of oligospermia, where the sperm count, the man has low sperm counts, what we do, we'll ask him to produce the sample, semen sample. We'll process it and take out the good quality sperms with the good movement, and we'll put it directly into the womb. So that the required concentrations will be attained, so that to improve the chances of pregnancy.
What is in vitro fertilization or IVF?
Assisted reproductive technologies, where the oocytes will be aspirated from the ovaries and then mixed with sperms of the male partner, then for fertilization purpose, and after fertilization the resulting embryo will be transferred back into the uterine cavity by transcervical route. We will call this procedure as in vitro fertilization and embryo transfer.